Story. One recent trend we've noticed is the increase in the number of young women seeking cosmetic procedures. But April Woodard reports it's not just young people who are going under the knife.
They're both patients of Dr.SheldonSevinor in Boston.
We wouldn't do any cosmetic surgery on anyone, whether they're 30 or whether they're in their 80s, if they weren't in great health.
The fact is, people are living longer and they want to look younger.
In the last 2 years, cosmetic surgery for men and women over 65 years old has increased over 400%.
Wow. And the results are nothing short of amazing. That's 88-year-old Stephanie 6 weeks after her chemical peel. Check her out before and after.
I'm crazy happy with the whole result.
Down aging is the fastest trend in my practice right now. I think because people are living longer than ever before in today's society. And when they look in the mirror, they don't feel as old as they look. She said, I might live 10 more years, 20 more years. I'm in great health. I feel great. But you know what, doctor? I'm not going to wake up to these 2 pancakes the rest of my life. And I said, what are you asking for? And she said, I would like some enhancement of my breasts.
Right now. 76-year-old Gladys Sargent had her first cosmetic surgery in 1988. An eye lift, a facelift, a nose job, and a chemical peel, all done at once.
I was so excited. I could not wait to do it. And as they were wheeling me down to the OR, I said to myself, boy, this is the greatest adventure of my life.
Gladys says she did it to boost her sagging self-esteem.
It was a kick, really, and it's carried me right through.
The number of cosmetic surgeries performed on people aged 65 and older has more than tripled in 4 years, up from 121,000 in 1997 to 425,000 in 2001.
Can you file for me?
Boston plastic surgeon Dr. Sheldon.Sevinor specializes in nipping and tucking those in their 6th decade and beyond.
So I tell my patients, it's okay. You don't have to apologize to want to undergo cosmetic surgery, assuming you're healthy, if you're in your 60s, 70s, or even in your 80s today.
Dr. Sevinor says advanced age itself is no reason to avoid having cosmetic surgery. He's more compulsive about safeguards with the 65-plus group.
By getting medical clearance with their own personal physician, getting clearance from the anesthesia department, and have it in a safe setting, that is, in a hospital environment.
Gladys Sargent's recovery took almost 3 weeks, but she says she'd do it all again in a heartbeat.
I'd say to every woman, go for it.
You've got a very pretty mom. Do you think that was part of your motivation? Because it looks like in some ways you look more like her now than you did before. Was that part of your motivation, do you think?
People do comment on that a lot more now since I've had my surgeries, but I think it's part of me, like, maturing and growing into.
And when I met Natalie for the first time, the major difference in her nose isn't from the side view. I think you have a front view, and perhaps you could tell. It was the width of her nose, and I knew that wasn't going to change. And I knew that she had a great deal of fatty tissue. I knew that the jawline and the neck wasn't going to change because of genetics.
All right, but let me ask you a question. What's the youngest person you've ever had come to say, I want you to do something to my face?
I've had many people come into my office at 13 and 14 with their mothers, teenagers, and the child will sit in the chair, and they may have an unattractive nose, and the mother may